This short video by the DISH team will review some of the changes that were recently made to two New Jersey Department of Health guidance documents. The first guidance document is titled COVID-19 Public Health Recommendations for Local Health Departments for K-12 Schools. The second document is titled COVID-19 Public Health Recommendations for Operating Childcare Programs. We want to emphasize that watching this presentation is by no means a substitute for reviewing the updated guidance documents. The updates to both of these guidance documents do address masking recommendations. The New Jersey Department of Health is still recommending masking as a layered prevention strategy for the prevention of COVID-19. Please note, as of March 7, 2022, the state mandate requiring universal masking for child care centers and schools expires. At that point, individual child care centers, school districts, and school boards will be able to make the determination as to whether universal masking is appropriate for their facilities. When schools or child care centers are making the decision about universal masking, consultation with the local health department is recommended. Many factors go into this decision. The slide on your screen now lists some of the factors schools and child care centers should consider when they're making their own masking policies. Individuals and families will, of course, also make their own decisions about masking. For example, if there are family members who are immunocompromised or otherwise at high risk, they may choose to have their children mask, even if that's not the school or child care center's general policy. Masking definitely still plays a role in the prevention of COVID-19, and the Department of Health still recommends universal masking in certain circumstances. The Department of Health ties masking recommendations to CALI score, with specific recommendations for universal masking when a school or child care center's community is in a region of high or orange or very high or red community transmission. So while a school or child care center's region is in very high transmission, which is red, the Department of Health recommends that schools require universal masking. When the regions have a CALI score that is high, which is also orange, the Department of Health says that schools or child care centers should consider implementing universal masking and that they should also take into account their ability to incorporate other layered prevention strategies. The slide on your screen right now is for the K-12 guidance, and it says when the COVID-19 risk level of community transmission is moderate or yellow, schools may consider implementing masking policies for activities or settings where there is an increased risk of transmission, such as music and singing and close contact indoor sports. For K-12 and child care centers, the Department of Health recommends that schools should consider requiring masks during an outbreak or a general increase in cases. Schools should consult with their local health department to determine whether short-term universal masking or masking in the affected rooms should be required to control the outbreak. Obviously, if it is a widespread outbreak or even widespread within a certain cohort, we'll be more likely to want to resort to masking. Additionally, the recommendation is still that individuals who return to schools or child care centers on day 6 to 10 of their isolation or quarantine should be masked. Additionally, if an individual becomes ill at the child care center or school, they are recommended to mask until they leave the premises if the child is age 2 or older, and if the individual can tolerate masking. Masking is also required for students in K-12 schools that are participating in Test to Stay, and in child care centers, masking is recommended for unvaccinated staff who work with children or infants who are not eligible for vaccination. As we mentioned before, there are some additional circumstances where mask wearing may be considered. When individuals are immunocompromised, or if they live with a person who is at a high risk for severe COVID illness, these individuals should consider masking. Additionally, individuals who are concerned about disease transmission should be encouraged to mask. And again, in K-12 schools during moderate or higher community transmission, schools may consider implementing masking policies for activities or settings where there is an increased risk of transmission. In general, individuals do not need to wear a mask outdoors, including during outdoor physical education classes or school sports, except during days 6 to 10 after completing a 5-day isolation or quarantine when mask wearing is imperative. However, schools and child care centers may encourage the use of masks during outdoor activities that involve sustained close contact with other individuals or during periods of high or very high community transmission. If an individual cannot mask correctly and consistently on days 6 to 10 after 5 days of quarantine, they should stay home for the full 10 days. If the individual remains asymptomatic during quarantine, they do have the option to test on days 5, 6, or 7 and return to school on day 8 if the test is negative. This wording is referring specifically to students who are able to test on day 5, 6, or 7 of their quarantine and receive a negative test. If a school feels they can safely accommodate a student who is unable to mask on days 8 to 10 of their quarantine, then they may want to consider allowing students who are unable to mask back on days 8 to 10 if they remain asymptomatic. Schools and child care centers who have not created a policy regarding universal masking may want to adopt one to plan for times when COVID-19 transmission is high or very high, and also in consultation with the local health department when an outbreak is occurring. So this would be a temporary transition until the transmission rate lowers in your region or the outbreak is concluded, but it can offer an added prevention strategy during these times. The infographic on this slide shows masks that offer the most protection and masks that should be avoided. During an outbreak, schools may want to consider implementing a testing program. Testing can be for staff and/or students and can occur school-wide in one classroom or grade, or in one section of the school based on the structure of the school and the extent of the transmission throughout the building. If the school chooses to test, it should be done as soon as the outbreak is suspected. Your local health department may recommend additional testing depending on how well controlled disease transmission seems to be. As stated, testing may occur regardless of vaccination status based on the availability of resources and local circumstances. Decisions to implement testing programs and/or transition cohorts to remote learning should be made by the schools in conjunction with the local health department and also based on the individual circumstances and resources. After March 7th, contact tracing will change significantly due to the close contact exception in schools being harder to implement. If students are not masked and they are within 6 feet for more than 15 minutes in 24 hours of a case, they will be considered close contacts. However, if the students are wearing a mask, either due to the school policy or for personal reasons, and the staff can confirm that both of the students, the positive case as well as the close contact, were correctly and consistently masked, then they can still fit into that criteria for the K-12 close contact indoor exception. Thank you so much for attending today's training to review the latest updates as of February 24th, 2022.